First, pull out the pressure knob at the tail of the hemostat, and install it above the pressure rod. Place the comfort cushion under the patient's thighs, and as close to the hips as possible. Withdraw the sheath 3 to 5 centimeters. When placing the main body, please ensure that hose dome is directly above the vascular puncture port. Find out the pulsation position of the femoral artery at the skin puncture point, which is at the junction 1 centimeter above the puncture external opening. Bind the Velcro belt on both sides. There are 3 types of bandages: small, medium, and large. You can choose the appropriate belt according to the patient's weight. When the compression dome is placed correctly, it should be evenly pressed on the puncture site. Viewed from the top, the main body and the Velcro belt should form a cross shape. When pulling out the sheath, press the front end of the hemostat with your left hand to prevent bleeding. At the same time, pull out the sheath with your right hand and keep pressing with your left hand. Turn the pressurization knob clockwise to pressurize. When the hemostat generates enough pressure, release the left hand. Confirm whether the pulse on the back of the foot beats normally. When the pressure is appropriate, put the compression knob back to its original position. Fill in the pressurization time and pressurization scale. For patients with coronary angiography and cerebral angiography, compression for 4 hours or more is recommended. 6 to 8 hours of compression is recommended for patients with percutaneous coronary intervention, emergency thrombectomy, and tumor intervention. After the first compression for 3 hours, the pressure can be reduced by 1.5 scales. According to the patient's condition and the doctor's judgment, the compression time can be adjusted appropriately.